Hello and welcome to my channel. This is the first lecture in the pelvis series, so let's begin. First, we will study the individual bones of the bony pelvis, which are the pelvic bones, the hip bones, two hip bones, and joined by the sacrum. Anteriorly, the hip bones are joined at the symphysis pubis, and posteriorly, they articulate with the sacrum at the sacroiliac joints to be joined there to form the bony pelvis, which is the part we are going to start with. Of course, the prominent bone is the hip bone. As you can see, it's irregular in shape. It has acetabulum on its lateral side, the acetabulum to accommodate the head of femur in the hip joint. We have an obturator foramen, as you can see here and here. This is the medial surface. Okay, observe the anterior superior iliac spine with the anterior inferior iliac spine. There are structures attached to these structures. Observe also the posterior superior iliac spine and the posterior inferior iliac spine. Okay, observe the greater and lesser sciatic notches that turn by ligaments into foramina. The greater sciatic notch, the lesser sciatic notch. Now don't be confused. The greater sciatic notch it's not between the posterior superior and posterior inferior, as you can see. It's between the posterior inferior iliac spine and the ischial or the ischial spine, part of the ischial bone. Now there are three bones, three components: the ilium and the ischium and the pubis. The pubis is the anterior part, the ischium is the posterior part, and the upper part is the ilium. So we'll be studying these individually. The ilium is the most superior of the components. It has an articular surface posteriorly, see, posteromedial. This articular facet to articulate with the corresponding articular surface on the sacrum to form the sacroiliac joint, with a rough area behind it. This is called the iliac tuberosity. See that? The iliac tuberosity. As you go further anterior, this is the iliac crest here, ending at the anterior superior iliac spine. See? And about 4 to 5 centimeters before the anterior superior iliac spine, you will encounter the iliac tubercle, the one that passes through the transtubercular line we studied before in the abdomen. This is the iliac tubercle, while the rough area at the back is the iliac tuberosity. Okay, inferiorly it has the arcuate line. You can see this arcuate line. It continues with the pectineal line of the pubic bone and the pubic crest. This is the pelvic brim, and actually these are called the linea terminalis of the ilium. Below that, the part of the ilium is forms the part of the true pelvic wall, which is I'm referring to the true pelvis, the one with all walls all around, not like the false pelvis at the top. We will study this later in the articulated pelvis. Okay, it has a gluteal surface, as you can see here. The posterolateral surface contains three gluteal lines, anterior and middle and posterior gluteal lines. You'll study these with the lower limb for the attachments of the glutei muscles. Also, observe the arcuate line, which is part of the linea similionaris. Above it is the wing of the ilium, and below it is the part of the ilium that forms part of the true pelvic wall. Okay, the rough area behind the articulation facet for the sacrum, is for the ligaments, attachment of ligaments that support the sacroiliac joint. It's one of the toughest in the body. It's called the interosseous ligament. We will study it here when we articulate the pelvis. See, this is other pictures of the hip bone to show you how the three components meet in the acetabulum, in the floor of the acetabulum, as a piece of cartilage. See that? This remains till the age of 21. So before 21, when you take an X-ray of the hip joint or hip bone, you will observe this dark line in the plain X-ray. So this is completely normal, because this is where the three components of the hip bone join together. See the lower part of ilium joining the superior pubic ramus and ischial body, as you can see here. This is the ischial body in the floor of the acetabulum. You see the Y-shaped articulation from the back. Okay, see, this is the articular facet on the posterior part of the iliac bone with the iliac tuberosity. You see this rough area. This is for the attachment of a ligament that fills the gap created between the iliac bone and the sacrum at the sacroiliac joint. Fills the gap as the interosseous ligament. It's a very tough ligament that forms this surface. Okay, the pubis is the anterior component of the hip bone. It's composed of a body. The upper part of the body, you have the pubic tubercle, which directed anteriorly. Observe that it's directed anterior, so it's not part of the pelvic brim, the pubic tubercle. The brim is the sum of the arcuate line, the pectineal line on the superior pubic ramus, and the pubic crest, and then to the other pubic bone. This is the pelvic brim passing through the promontory, which is the upper border of S1. Okay, so this is the pubis. As you can see here, this is the pubic tubercle. This is the pubic crest. See the pubic crest? Okay, this is from a lateral view. Okay, now you can identify two rami for the pubic bone, the superior pubic ramus and the inferior pubic ramus. The superior pubic ramus, observe that it forms the obturator groove that forms the upper part or the ceiling of the obturator canal for the passage of obturator vessels and nerve. As you can see here, this is the iliopectineal eminence, where the superior pubic ramus meets the ilial component of the hip bone at the iliopubic eminence. It lies at the line of the brim of the pelvis, of the true pelvis, the upper aperture of the true pelvis. Okay, observe the arcuate line here. Observe the beginning of the sacroiliac joint. This is the sacroiliac joint. Okay, so the pubic bone has a body, has medial surface to articulate in the symphysis pubis with the other pubic bone, has a superior pubic ramus at the pubic tubercle, and an inferior pubic ramus, as you can see, that joins the ischial ramus to form the conjoined ramus. Okay, the ischium is the postero-inferior part of the hip bone. It has a large body, and you've seen the upper part of the body meeting the superior pubic ramus and the iliac bone in the floor of the acetabulum. It has a large body with a tuberosity on the back of the body extended downwards. We sit on part of this tuberosity, not all of it. It has an ischial ramus, as you can see here, that joins the inferior pubic ramus to form the conjoined ramus, or the ischiopubic ramus, as you can see here. See that? It has a spine. This is the spine, but it's broken in the specimen. See the spine? The spine of the ischial bone, the ischial spine, is part of the ischial bone, and it's directed medially, and it's pulled upon by the sacrospinous ligament, which forms a part of the true walls of the true pelvis. Okay, so remember the ischial body, the ramus, and the spine, and the ischial tuberosity. We will study further divisions of this ischial tuberosity into an upper quadrangular part and lower triangular part. But when we study the muscles of the back of the thigh in the lower limb. Okay, the piece joining the two bones at the back is the sacrum. It's composed of 5 pieces of vertebrae united together. See that to form the this inverted triangle that has an apex that articulate with the coccygeal vertebrae, and a base, which is an upper surface that articulates with L5. Okay, the upper surface for L5, the sacrum is angulated upon the lumbar vertebrae, so the L5 disc is thicker anteriorly than posteriorly, and a large facet on the lateral surface for articulation with the ilium, with a posterior rough surface area for attachment of the interosseous ligament that fills the gap between the two bones. The superior surface of S1, the anterior border of S1, anterior edge, is the promontory, not the lower border of L5, and this is an MCQ question. The upper border of S1 is part of the promontory, and the 2 bony masses at the sides here are the ala of the sacrum. Ala of the sacrum to articulate with its corresponding area on the ilium. Okay, to form the sacroiliac joint. As you can see here, as a result of articulation of vertebrae, now we have 2 sacral foramina on each side, anterior sacral foramen and posterior sacral foramen, anterior and posterior, anterior and posterior. Remember this, the posterior for the dorsal rami, the anterior for the rest of the nerves. Okay, because of the joining, the way the vertebrae joined together, they formed this anterior and posterior intervertebral foramina, different of course than the single intervertebral foramen on each side of the vertebrae. The sacral canal is a continuation of that of the vertebral canal, and descends down till the inferior hiatus. Here it's called the sacral hiatus, and where it ends, the canal, the bony canal ends, and it's also between the fused laminae of the parts, different vertebrae of the sacrum. Defective, of course, of the last one. You see, the sacral hiatus is a little bit higher, at a little bit higher level. Also, you can see on the dorsum of the scapula 5 distinguished bony prominences. One at the median, called the median sacral crest or line, formed by the union of the spinous processes of the sacrum. See that? The median sacral line, it's only one line. We have an intermediate sacral line, as you can see here and here, formed by the union of the articular processes, the superior and inferior. This is the medial, with an L, sacral line or crest, and a lateral sacral crest that's formed of the union of the transverse processes of the sacral vertebrae. So 2 lateral sacral crests by the union of the transverse processes, 2 medial sacral crests by the fusion of the articular processes, and one in the middle is the median sacral crest or line that's formed by the union of the spinous processes of the sacrum. This is to describe the dorsum of the sacrum. Now, the last individual bone on of the pelvis is the coccyx. It's 4 vertebrae articulating together in an upside down triangle, with the base above to articulate with a corresponding surface on the sacrum. and extends below for 4 vertebrae. There are 2 horns or cornea that represent the rudimentary articular processes that between vertebrae, and on the lateral side there is a rudimentary transverse process, as you can see here. Okay, so this is the composition of the coccyx, and remember, it has no vertebral canal. The canal ended at the hiatus. Okay, so remember this. There is no vertebral canal in the coccyx. Of course, the joints between the vertebrae is of the symphysis type, and they get ossified with age. Okay, these intervertebral joints. Okay, so this is a description of individual bones of the pelvis. Next time we will articulate that pelvis and see what we have. I hope you had the maximum benefit of this lecture, and I thank you very much for watching.